Direct unprotected exposure to the sun's ultraviolet rays can lead to health implications such as damage to the skin, eyes, and immune system. Medical and public health practitioner Dr. Francis Martin is advising people to be very cautious when venturing outdoors, as there can be both short and long-term problems arising as a result.
So, directly in the sun, you can actually get sunburn depending on the temperature, and so and this is for the exposed part of your body. So those parts of your body under your clothing are less likely to be exposed to sunburn, and so you probably want to protect your skin either by covering it or using those sun lotions and so on. You can also get faster evaporation of water and salt from your skin, through your skin, because your skin, if water can evaporate from it. So your rate of dehydration increases tremendously. And not just, then we know that there are certain skin rashes that can come. I mean, heat rash is a common one, but if someone is predisposed to any kind of autoimmune skin disease like eczema, for example, they're being exposed directly to the sun can increase the risk of them having an outbreak of the rash.
In the short term, exposure can also cause a mild reddening of the skin as a sign of damage, while longer-term problems can speed up aging of the skin, making it leathery and wrinkled. Other complications of the heat are respiratory and cardiac problems. The most serious effect is an increased chance of developing skin cancer. The health practitioner said visits to his office has increased as a result of the heat.
Absolutely. In my own private practice, almost every day I would see one or two persons that's coming in with heat-related issues. And it stems from heat-related dehydration and electrolyte imbalances that causes them to feel really, really unwell, or skin rashes. Skin rashes are actually been the most common that we see. I have actually seen a few persons who have had collapse because of the heat. Not bad enough to have them end up in hospital or so, but they just really fainted off a little bit and then came in for us to see them. Because the heat can cause the heart to beat in a very abnormal fashion, and that if you have a predisposed cardiovascular risk factors, let's say for example you have high cholesterol, heart disease, or diabetes, you are at increased risk of having bad heart rhythms, or arrhythmias as we call them, because of the heat. If you're predisposed to respiratory conditions like asthmas and chronic bronchitis from people who smoke a lot, they can also have increased outbreaks because of the increased heat, and so they need to be careful too.
Okay. Here's what you should do, especially with children.
Children are very robust. They have a really wonderful physiological system. So it's just a matter of replacing the fluids that they've had. Of course, you probably don't want to you may want to decrease the period of time of the exercises and so on. If it's an hour, you probably want to say let's do 45 minutes or half an hour, so that your body less likely to go into exhaustion. But replacing the fluid and replacing the electrolytes is absolutely critical. And especially for children, replacing the fluid and the electrolytes means not giving them carbonated beverages.
Christine John, GBN News.